So Moderna made the news this past weekend. God, a lot of people made a lot of money. I'm guessing a lot of them had inside information. I'm just guessing because who would just randomly has like crazy calls on like way out of the money call options on some of the stuff without a little bit of inside info. I don't know. Maybe they were just doing their research and they knew that they were working on this drug. I don't know. But Moderna stock went parabolic this week. I'm sure everyone knows who Moderna is after the pandemic. They were one of the people that created the one of the COVID vaccines, of course. Made a lot of money off that. But Moderna stock surged over 110% after announcing the first ever positive phase 3 results for a personalized cancer vaccine. First of all, to double your stock price in a day is insane. So as you can look at this chart, they were hovering around, what is it? We were at like heading into Thursday, we were hovering around $62 a share. Okay. And as you can see, well, let's go back a month. Yeah. Look at this. Over the last month, I mean, we're anywhere from 55 to 60, 62, right? We're not, we're the usual up and down, right? Nothing crazy. I'm no stock expert, no financial analyst for you, but for a stock to double its price in one day, not normal, right? And as you can see, it kind of peaked out here. So it started out at 62, went up to 161 at one point. Then people kind of got themselves together, dropped down to 141, and then we hit a peak of 189. Now we were just, hey, we're getting a little ridiculous. What are we doing? But I mean, still, even to this point, the stock is sitting at what is it, 145.13. So 1.5x its stock price almost. No, what is that? Yeah, almost 1.5. Yeah, almost 1.5 exit. That is crazy. That is crazy, and that has to do with a drug trial that came out pretty positive. So Moderna made a cancer vaccine that is custom for every person. Doctors read the DNA of your tumor, find what makes it unique, then make an mRNA shot that teaches your immune system attack cells that look like this. They combine it with Keytruda, a drug that helps stop cancer from hiding from your immune system. It just succeeded in phase 3 melanoma trials. Not a cure for all cancer, but a pretty huge deal if it works for other cancers too. Now, I want to start here with this. A lot of people are going to have negative feelings about this because they're going to see mRNA. And I get it. Especially when you've been burned by the government before and burned by these drug companies before. I get it. mRNA, the idea behind that technology to deliver drugs, in this case a vaccine, into our cell system, the idea behind it is great. It's solid. I just don't personally think we're there yet. I don't think we've mastered it. Definitely not for like the COVID vaccine or your typical flu vaccine. We definitely aren't there. But I do hope this is actually something that is viable, because we do have a lot of side effects from the mRNA vaccines. That's why I was against pushing any vaccine on anyone without informed consent and without their own permission, and saying that, hey, it's not forcing you to get it. You just lose your job if you don't get it. That's forcing someone to do it. You're taking away their livelihood. You're taking away their ability to provide for their family. So you're basically forcing them, which we went through a lot of that with COVID. But it's a little bit different when it's your choice. And if you're facing death by cancer or potential side effects from a vaccine that looks like it will cure your cancer, you might have a couple nasty side effects, but you might be alive. You get to make that decision. I'm all for that. If that's something you're like, hey, I'll take it, I'll risk it. Maybe I lose the ability to use my left arm or something, but I'll be alive. Won't be dying from cancer, right? So I think this is interesting. I don't know if the technology is fully there yet, but I'm also skeptical about this trial. I wanted to find something too. I was hoping to stall and delay and look here for a second. Basically, Elon tweeted out about it too. What was this, on the 19th? Elon tweeted something along the lines of, I guess I could just pull up his X account and go through his replies real quick. But he was promoting the mRNA technology and vaccines, and he feels like it's a pretty promising thing for the future. And listen, say what you want about Elon. Guy's been right about a lot of stuff. And I do think the technology, so in this case, what we're talking about, the technology, the ability for mRNA delivery system to actually get in and attack specific cells. It's like if you're trying to break into a house, right? Well, if the doors are locked, it's going to be really hard for you to break into the house, okay? But if you have the key or the front doors left wide open, voila, easy. So in this case, the vaccine, so what they do is they take your specific tumor, they take the DNA and all of it, and they mix it all together, and they put it into their little mRNA vaccine specific for you, and it teaches your body, hey, don't attack every single cell in your body. We want you to attack specifically these cells. It gives you the key to the front door. It opens the door wide open for the drug to go in and just attack those cells instead of attacking every cell in your body and killing you, right? I can't find the thing you tweeted out, but whatever. So the idea behind it is great. It is. Now I heard it's pretty intense. It's a lot of shots. I don't know. The problem I have with this is why I'm skeptical about it. I can't find any article. I can't find any actual published literature. I went to the New England Journal of Medicine. I couldn't find anything there. I can't. This sounds like it's just based off of Moderna's word, which I don't trust. Hey, our trials looked really good. You know what I mean? Like, maybe it's come out. Maybe I just can't find it. If you guys do know where it's at, please comment on this. Drop it in the chat right now. I would love to be able to read up what the actual evidence. Because listen, any of you, I'm guessing 99% of you have never read a drug report or a drug study. You can't just read the headline. The headline is usually just BS. It could say such and such drug. These nicotine pouches helped cure small puppies from dying. All right, or whatever. Okay, cool. But if you actually go through and read through what the study actually did, and you got to dig through a bunch of boring shit. I don't know about you, hopelessly, but I hated drug literature when I was in school, but still did it. Found the art of it interesting. But the thing that pissed me off the most is most of the studies, what the title says is not really what happened, or it did happen, but they don't tell you the but. They don't tell you like, hey, look at all this, look at the side effects for a minute, or look at this data that we decided to exclude from the study because it didn't help our case. Common thing with this would be like, hey, this drug cures cancer. Well, we only studied it on 100 patients, so not a big sample size. Oh, by the way, all those 100 patients happen to be like 45-year-old Caucasian females. Okay. So maybe it works for them. Did you study it on males? Did you study on African Americans? How about the Asian population? Like you gotta diversify a little bit, but they'll exclude all that because that's not what they studied, because it doesn't fit their narrative. It doesn't fit what they're trying to publish and push out. There are some people pushing back though. This guy says, and I'm not endorsing it, I'm just going to read what this guy said because I thought it was interesting. Moderna mRNA 4157 cancer vaccine doesn't work. Says it's going to cost about $500,000. You get 27 injections, so 18 Keytruda, 9 mRNA. Grade 3 side effects, 36% of patients had a grade 3 or higher side effect. Claimed benefit, minimal survival benefit. This is the expensive garbage that Big Pharma puts out, which is completely outperformed and left in the dust by ivermectin. I can never say this one. Membendazole and fenbendazole at the tiny fraction of a cost. Okay, first of all, I have nothing against using ivermectin or any of these other drugs, but I feel like once you put that in there, you're clearly biased. And second of all, how do you know these numbers? Because from what I can see, I see people tweet about it, but I don't see anyone pulling up actual data from the study. That's what I want to see. Well, I can't really trust it. And also, the side effects doesn't really bother me because the alternative is death. It depends what the side effects are, of course, and what's the survival rate, what's the expected like recovery, like how long are you supposed to are these people living after they cure their cancer, or does it come back within a year, right? That stuff more interests me than, well, 36% of patients experience some serious side effects. Okay, well, the other alternative was they die from cancer. Oh, here it was. Elon right here. Despite its obvious misuse during COVID, mRNA has tremendous promise for curing diseases. Artificial RNA essentially makes curing diseases a software problem. I think there's something to that. I don't know if we have the technology to do it yet, but the theory behind it is there. It is absolutely there. This one was interesting. Because I also, this is kind of where I ran into. It says all the hype and the huge stock surge over the mRNA cancer vaccine cannot be confirmed with real data. I checked Moderna's website, checked clinicaltrials.gov, nothing. That's the thing. We're hyping up the stock based off of Moderna putting out a headline. I'm a little skeptical, but I will reiterate, I hope this is true. I hope we are starting to find a way for people to have an option, especially a way to cure cancer. That would be awesome. I think everyone's for that. I'm glad that it's patient choice, right? But I'm skeptical until I see some more data. So until we get more data, I'll keep an eye on this story. And if we do get those trials, or at least some concrete data, I can't wait to come back here and talk to you about it. And hopefully it's for the positive. But smash the like button, subscribe to the channel. Catch you guys in the next video.